Well, in the continuing saga where somebody should go to jail, that's the name of my new DVD/CD coming out here, somebody needs to go to jail, a federal jury in Lafayette, Louisiana, last week awards $9 billion. $9 billion to the people who sued them, of course, you'll see why in a second, over conspiring and hiding Actos risk, okay? Takeda Pharmaceutical Company was a Japanese partner of Eli Lilly and Company, which is out of Indianapolis, were ordered to pay a combined $9 billion in punitive damages after a federal court jury in Lafayette, Louisiana, found they hid and conspired to hide the cancer risk of their Actos diabetes medication in the first U.S. trial of its kind. Takeda, based in Osaka, Japan, was ordered to pay $6 billion by the jury, and the Indianapolis-based Eli Lilly, Takeda's partner in this manufacturing of this drug, was ordered to pay $3 billion. And I hope Takeda executives in Japan heard what this jury had to say loudly and clearly, says Mark Lanier, a lawyer for former Actos user Terrence Allen, after the verdict. The jury earlier awarded $1.5 million in compensatory damages to Allen, who claimed the drug for his cancer. Takeda, Asia's largest drug maker, faced the Actos claims after it scrapped development of another diabetes drug this year when research linked it to liver damage and liver cancer. More than 2,700 Actos lawsuits have been lodged and consolidated before the U.S. District Judge Rebecca Daugherty in Louisiana for pretrial information exchanges. According to court dockets, Daugherty presided over Allen's trial. The $9 billion jury award is the seventh largest in the U.S. history based on data compiled by Bloomberg. Okay. Let's see here. And is almost certain to be reduced because the U.S. Supreme Court has said punitive verdicts must be proportional to the awards of compensatory or actual damages that underlie them. This country's highest court has said in some cases punitive awards that amount to 10 times a compensatory award would be acceptable, okay, because of the conspiracy aspect of it. Now, remember, this thing doesn't stand alone here. This is part of the environment of the pharmaceutical and medical environment. Remember, each year, and this is from the Institute of Medicine, the Journal of the American Medical Association, and the Center for Disease Control, the federal agency that tracks this stuff, each year, this is a yearly figure, ladies and gentlemen, a yearly figure, each year in America, medical doctors kill, injure, and infect 15 million Americans in their workplace. Now, if you're driving and holding your cell phone in your hand and texting, it's a $280 fine. If a doctor kills somebody, they go out and have a martini. Okay, there seems to be some discrepancy here. There's not equal punishment for the severity of the crime. And so we're going to have to take control here because the medical system has failed us. The government has failed us. There's no oversight of the medical system. Each year in hospitals alone, medical doctors cause 2 million infections, of which 90,000 people die. What would happen if 90,000 people were killed in domestic airlines each year? Nobody would fly. And yet, everybody wants to run to their doctor over every little thing. Some people think it's a joke. They take a sick day so they can go out and play golf in the afternoon and get paid for that sick day, and they go to their doctor, get some blood taken and so forth. I don't know if you know this, but each month in America, this is a monthly figure, according to the CDC, again, the Center for Disease Control, and the U.S. Department of Health and Human Services, Office of Inspector General, they said in 2010, each month in America, medical doctors in hospitals alone kill 15,000 seniors over the age of 65 who go in for minor medical procedures and screening tests. Let's see some examples, some famous people who are examples. Neil Armstrong, our top astronaut. Andy Rooney from 60 Minutes. Dick Clark from American Bandstand. Doctors killed them as soon as they shot them in the head. And the doctors went out and had martinis, played golf that afternoon. Now, if they can kill these people and get a walk, what do you think your doctor would get for punishment if he killed you? Nothing. He goes out and has a steak dinner. And so I urge you to turn the tables on them. And, of course, we're not asking you to do anything physical to your doctor when they kill your mama or injure or maim one of your family members. What I want you to do is take the time to get a hold of the trilogy of books, Let's Play Doctor, Let's Be Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, aromatherapy oils. And look at the chapter in the book, Let's Play Doctor, particularly. It's the chapter on home-based laboratory. And it'll teach you how to do your own diagnoses, how to monitor your own diseases so that you'll be able to, in fact, avoid going to the doctor for any reason. Now, you know what would happen if everybody were like me, not going to the doctor for 68 years, never being on a prescription medication? They'd be real humble. They would start sending you. They'd be like the old Maytag repairman. They sit there throwing cards in their hat because they have nothing to do. They'd leave town. That's what we want. We just want them to leave town quietly. We can do it. You have to participate. Stick with us. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, I thought we'd continue talking about these medical mistakes, as I've got one out of the UK, and the headline is, Pregnant Woman Dies After Horrifying Medical Mix-Up. This all happened at the Queen's Hospital outside of London, and the woman was a 32-year-old woman by the name of Maria de Jesus. They say as far as medical mistakes go, this is a horrifying one. A woman underwent an operation. She was suffering appendicitis and needed to have her appendix removed. Instead, her right ovary was taken out, and De Jesus, who was 21 weeks pregnant, ended up dying 3 weeks later. The case is now in front of a medical tribunal, which is weighing the medical fates of two doctors involved, a then-trainee surgeon, Dr. Yahya Al-Abed, and Dr. Babatunde Coker. And he was supposed to be supervising Dr. Abed. Say during the surgery, De Jesus began to bleed quite heavily. In the midst of this, Mr. Al-Abed removed what he clearly believed to be the appendix, removed it, gave it to a nurse, and it later turned out to be her ovary. Coker, who was supposed to be watching this guy, was busy eating his lunch at the time and was never summoned, nor was he made aware the surgery was even taking place. The mistake wasn't uncovered until much later. And the Telegraph reports that De Jesus returned to the hospital in severe pain 2 days later. Another doctor realized she still had her appendix, and the next day she went into surgery to have it actually removed. Instead, she died on the OR table, having earlier delivered a stillborn boy. The cause of her death was ruled multiple organ failure due to septicemia, so obviously her appendix had ruptured.
Yeah, well, that should be murder for two people, the embryo and the lady. That kind of reminds me, and this is one of Char's favorites, is there's a gal in Orlando, Florida, 28 years old woman, went in to have her first baby delivered, and the OBGYN cut her arms off at the elbows and her legs off at the groin. Now, I guarantee he's one of these doctors on drugs, okay, and he's having hallucinations or something. And the guy's still working at the hospital there in Orlando, Florida. I mean, somebody needs to go to jail here, okay? And it's one of those things where this is so egregious, and doctors get a walk. You know, the thing, these people just do not get held responsible for this. And so if nothing else, today's program, you know, the monologue and the pearls of wisdom here, should alert the general public, Doug, that they do have to take responsibility for themselves. And people say to me, well, it's terrible those things happen, but people do use drugs. And, doctors should know better. They get trained in pharmacy. They should never do drugs. And there's no excuse. I do not cut them any slack. And especially when a doctor hurts somebody and they've been illegally using drugs or they're being put on drugs by prescription, they should not be doing surgeries and so forth. They should be taken off the surgical eligibility list and sit in a desk and look at records. And even then they're dangerous, so they're looking at records if they're on prescription drugs. And so I don't cut them any slack. If we put the worst ones in jail for life, suddenly now they'll all be real careful. Right now, there's no reason for a doctor to go out of his way because there's no punishment. There's no punishment, and so as a result, they just really don't seem to care much. Well, thank you so much, Doug. Super job on that one. And stick with us, folks. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie for these messages. Okay, Doug, let's go to callers.
Let's head to Santa Cruz, California. And Henry, you're on with Dr. Wallach.
Hello, Henry, sir. You're on the air.
Hello, Dr. Wallach. Thanks a lot.
Yes, sir.
My son, who went away to college 3 years ago, his first year away, he developed, gee whiz, what is that? Tonsillitis, excuse me.
Mm-hmm.
And eventually he had to go to the doctor. He had to take the antibiotics, and then he finally cleared it up. And then last year, he got it again, went to the same motions. This year, he didn't get it, but this year he has been on the Healthy Start Pack, actually the Healthy Digestive Pack with the additional EFAs as well as the selenium. But anyway, I would like to know if you can talk a little bit about this, because I really don't know much about it, so I don't really understand. But, of course, right away, the doctors, when they see him, they want to pull his tonsils out, and I said no. And so...
well, this is a year after. This is a year after he was healed. They now want to take his tonsils out.
Yeah, actually, when he first went in, they wanted to take his tonsils out.
Mm-hmm. And they gave him antibiotics, and he recovered. And that happened the second time. Then you got him on the Healthy Start Pack with extra EFAs.
Yeah.
And then, so did the doctor contact you and say, hey, why don't we take his tonsils out so he doesn't do this again? Or
after the first year, he didn't bother us anymore about this. But this year, he didn't get it. So I'm wondering if you could talk a little about this whole thing with the whole tonsils and
sure. Okay.
If you could build a protocol so I can have him take something that's going to prevent this in the future.
Sure. Okay, well, tonsils are kind of like a lymph node. They're lymphatic tissue in the back of your throat, and they kind of filter stuff. They protect you from inhaling and swallowing bacteria and viruses and fungus and yeast. They're kind of one of the filters that filter stuff as you eat it and swallow it and drink it and so forth. Inhale it. Everything has to go by the tonsils. And so they are one of your first lines of defense. Your immune system includes your skin, your sweat, antibodies, tonsils, appendix, the Peyer's patches in your intestines, your liver, your spleen, your lymph nodes, your bone marrow. I mean, your immune system is a very complex, multi-featured, I would call it a multi-system. It's not just one system. People think the immune system is one system. Your digestive system, the whole thing is part of your greater protective devices, okay, your immune system. And your immune system requires 90 essential nutrients just like anything else. The immune system doesn't operate in a vacuum by itself. And so people get the sense that if I just take some antibodies or if I take injections and vaccines, everything will work. Well, it doesn't quite work that way because, again, your tonsils, your appendix, and your thymus, your lymph nodes all need the 90 essential nutrients to do their function. And so that's the short version of it, 90 essential nutrients, and stay away from the bad guys, and it all works. Back after these messages.
Let's head to Utah. And Casey, you're on with Dr. Wallach.
Well, Casey, you're on the air.
Hey, Dr. Wallach, how you doing today?
Okay, sir. How can I help you?
This is a little ironic to the last caller, but my brother's got a 12-year-old border collie blue heeler mix. She's about 80 pounds, and I don't know how long ago it was, but she developed her lymph node glands, started to swell, and one of them, he tells me a few days ago, is swollen so large and so hard, it's basically as hard as a rock. He took her to the vet. The vet did a biopsy to determine, whether it's cancerous or not. And, gave her all these, gave him all these options for, surgery. And then he put her on prednisone. And he just told me today that he gave her a little prednisone, and the prednisone helped the swelling go down a little bit. So I was just wondering if there's anything else we can do to get the lymph nodes to, come back down to normal size.
You had the results of the biopsy. Was that lymph node cancerous?
We're not sure yet.
Okay. All right, well, as a stopgap thing, somebody can do. How much does that collie weigh again? You say 70 pounds?
80.
80, okay. Well, what I would do is give it 3 scoops of our Arthrodex. It's 1 scoop for 25 pounds of body weight. And I would also give it the Z-Radical. I'd give him Z-Radical. And that's designed to support the immune system, particularly for diseases like cancer and lupus, things like that. your immune system is your best friend. So let's just hope and pray that these lymph nodes and large lymph nodes in the collie maybe due to some infection that antibiotics may be able to help, as opposed to being lymphoma or Hodgkin's disease, that sort of thing. But in the meantime, 3 of the scoops of the Arthrodex per day. I'll probably take him 2 of those canisters per month. I'd also throw in 1 ounce of the Z Radical per day. You can just mix it in with his food. Tastes pretty good. Kids like it, so dogs like it. And then call me as soon as you get the results of the biopsy, then we can be a little more specific. Okay, Doug, let's go to callers.
All right, let's head to Indiana. And Pat, you're on with Dr. Wallach.
Pat, you're on the air.
Hi, Dr. Wallach.
Hi. How can I help you?
My question is, I saw you on Benny Hinn, and you were talking about rheumatoid arthritis, and you mentioned minocycline, but you also said there were 2 herbs that you could take that would take about 2 months to work. Can you tell me what those 2 herbs were?
Okay. Minocycline, kind of like the bait fish, minocycline will kill the mycoplasma usually in 2 weeks. And then, of course, when you have crippling rheumatoid arthritis, where you get a lot of malformations of the fingers and the wrist and so forth, and other joints, it takes anywhere from 60 to 90 days using the Healthy Bone and Joint Pack to give the body the raw materials it needs to support and promote maintenance repair. Now, personally, I don't like antibiotics if you don't have to use them. I mean, if you have to use them, they can be a life-saving thing. You can cure syphilis in 2 weeks with penicillin. You can cure bacterial pneumonia with penicillin. You can cure bacterial meningitis with penicillin. So antibiotics can be very useful. But hang on, I'll answer the rest of your question, Pat, after these messages. Okay, Doug, we're going right back to Indiana and Pat. All right. And so let's say now you choose not to use antibiotics. What can you do? We actually have a blend of 8 herbs. It's called Killer Biotic. And 2 of those 8 herbs actually have antimicrobial properties. And I've learned a long time ago, Pat, not to, when people ask, well, what is the secret sauce? What is that mineral? What is that vitamin? What is that herb? I don't like to give that out because then people run to the store and they buy that herb and then they take it and it doesn't work. And they say, well, I tried Wallach stuff and it didn't work. You have to use the whole recipe. It's kind of like if you don't like some of the ingredients in your grandmother's favorite famous angel food cake recipe, and you only put in the McCormick's vanilla extract and leave out everything else, you're not going to get grandma's cake mix. So I just tell you the recipe as it is. Obviously, you'll be able to figure it out once you get the recipe. But so I don't like to give out individual things. Even if something's a calcium deficiency, I say take the Healthy Bone and Joint Pack because it has all 90 essential nutrients and extra stuff, again, to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue. And, of course, this would be part of the deal. If you have rheumatoid arthritis, in addition to the Killer Biotic, I like to give people, if they have active rheumatoid arthritis and the joints are still sore and red and inflamed and enlarged and tender, I'd have them take 3 of the Killer Biotic twice a day per 100 pounds of body weight and 1 Healthy Bone and Joint Pack per 100 pounds of body weight. And you get over 150 pounds at like 15 glucogel a day, and that's all designed to support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae and bone matrix. Give us a call every couple of weeks. Give us a progress report. If you have any more questions, give us a call. Okay, Doug, let's go to callers.
All right, let's head to Kyle Ann in Michigan. You're on with Dr. Wallach.
Kyle
Yes,
Ann.
hi. Thank you for taking my call.
Hi.
I am calling about 2 young girls. One is 16 and one is 15. The 16-year-old has hyperhidrosis. She's a tennis player. She has excessive sweating from the hands and feet. And the other one has Tourette's. And I know that that's something that you have been blessed to be healed from.
Okay. All right, what do these girls weigh?
I think they're about probably 120 pounds.
Okay, both of them. Yeah, they're about the same age, so 120 pounds each. Okay, well, Tourette syndrome, again, as you point out, I had that. My story's in the book, Dead Doctors Don't Lie. My Tourette syndrome, I had it for 5 years. It got gradually worse and worse and worse and worse. My friends said I was possessed because I was grunting and grinding my teeth and having facial twitches and tics and that sort of stuff, getting worse, worse, worse. Make a long story short, I started taking calf pellets which had the 90 essential nutrients in them, and in 3 days' time, it was gone. So I knew when I was 9 years old that I could reverse that sort of stuff. So at 120 pounds, I would get both these girls on a gluten-free diet. Are they sisters or cousins or what?
Just friends.
Just friends, okay. Well, I'd get them both on a gluten-free diet, okay? And I'm sure that they have other problems. Anytime you have something going on with the brain, nervous system, or you have something going on with the skin, whether it's hyperhidrosis, excessive sweating, or eczema, dermatitis, psoriasis, rosacea, acne, that sort of stuff, they need to be on a gluten-free diet, drop dead, no wheat, barley, rye, and oats. That includes the dog, the cat, the bird, the fish, the mother-in-law, mom and dad, other siblings. Everybody in the household has got to be gluten-free. No fried foods, no processed meats, no oils. That means no olive oil, absolutely no coconut oil, no margarines, mayonnaise, salad dressings, cooking oils, and no gluten again, no wheat, barley, rye, and oats. Then I would give them both the healthy bone and joint pack, each of them. One healthy bone and joint pack, divide everything in half, give them a half a dose of each thing twice a day. So one healthy bone and joint pack will last a month. And I would also give them both or give the girl, the 16-year-old with the hyperhidrosis, the hair, skin, and nails. Has special things in there, especially for the health of the skin. And I have her take 2 of those twice a day. That's 1 bottle a month. And one with the Tourette syndrome, I'd have her take the de-stress capsules, 3 of those twice a day. That's 2 bottles a month. And the Smart FX, 3 of those twice a day. That's 2 bottles a month. That's the DHAs and EPAs, which has the raw materials for your neurons to make neurotransmitters. And then give me a call every couple of weeks if you would, Kyle Ann. Okay, Doug, we got time to start another one, or?
We certainly do. Let's head to Texas. And V, you're on with Dr. Wallach.
Hello, B, you're on the air.
Hi. Thank you for taking my call. I've been listening, and I'm hoping you can help me. My son, he is 18, and he's having the hardest time trying to remember things from minute to minute sometimes. His short-term memory is almost like blown. He's a senior, and he's having a hard time studying.
Okay,
and
let me ask you a couple of quick questions here. Do you have any other children?
No.
Okay, he's an only child?
Yes.
Okay. Did you have miscarriages at all?
Yes, I had a few.
Okay. Well, let me ask you, does he have any history of skin problems, like eczema, dermatitis, psoriasis, rosacea, acne?
I have something to tell you. When he was he was about 1.5, 2, he broke out. He was a 7-month baby. And when he was about 1.5, he bloated, he broke out, and he had a rash for 6 months. He's never had, I'm thinking he had all of mumps, measles all in one, but the doctor told me that it would take him 2 years to 18 months to 24 months to get over this rash. He was just bloated, and his skin was awful.
Okay, let me stop you there. Did he have any respiratory stuff, any asthma, chronic bronchitis or anything?
We were in England, so he had a problem breathing. I was always clearing out his nasal passages. I thought it was just that he had allergies.
We don't have a lot of time here. And so, did you have any history, when you were a kid or a teenager, do you have any history of respiratory stuff, eczema,
yes.
dermatitis? Yes.
I have hay fever now. I'm in Texas, and I still get it, and I'm allergic to whatever's blooming. It seems to affect me.
How much does your son weigh?
About 115, 120.
115, 120. Okay.
Right.
This is a Shar thing. Okay, so I'm going to let Shar say something to you here. And if we get cut off here because of the restriction, we'll come back to you, so don't run away. This is too important. You're going to have to do the same thing your son is, okay? Because you passed this on to him. And Shar, what do you think her son has? You've been listening to me here.
Yeah, I have. I'm standing by here. He has a gluten intolerance that was inherited by his mother. Yep, got to get on. Yeah, got to get on a gluten-free diet right away. Everybody does.
And 120 pounds, what would you give him as a supplement program?
For a growing child, I give him the healthy bone and joint pack.
Okay, very good. So yeah, he needs one healthy bone and joint pack, And that would last him a month. Cut it in half. Give him a half a dose of everything. It's like a tablespoon of the OsteoFX Plus at breakfast and dinner. 1 scoop of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner. The 3 EFA Pluses, he could have it 1 at breakfast and 2 at dinner, so he doesn't have to take any pills or capsules at school. No oils, no margarines, no fried foods, no gluten, no wheat, barley, rye, and oats. And you need to do the same thing. If you have brothers and sisters, you need to get them going here. And for the short-term memory loss, I'd get him on the de-stress capsules. Give him 3 of those twice a day. It's 2 bottles a month. And the odds are that'll take care of it. Give me a call every couple of weeks. Let me know, because you should see rapid results in his memory returning if we're correct. If not, we can add some other things, but I'd prefer not to, not necessary. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And we're going right back to Texas and B, Doug's second question. And off the air, B asked another question about migraine headaches. And again, I would have B take the same dietary restrictions as her son, because she passed it on, not genetically, but through cord blood and our breast milk, the gluten intolerance, and the resultant malabsorption over time of nutrients resulting in this stuff, including the short-term memory loss. And in addition to everything that we talked about for her son, I would also be sure that she's also getting the de-stress capsules and the Smart FX, which has the DHAs and EPAs in them, which is going to help her son, and with the memory, short-term memory loss, and also with cognition problem solving. But also, Mama is going to help her with her migraine headaches. Okay, Doug, let's see if we can get another caller in here.
All right, let's head to Louisiana. And Celeste, you're on with Dr. Wallach.
Oh, Celeste, you're on the air.
Hi. I was listening to the radio, and I was trying to put my family, see what I needed to put my family on. We can start with Ethan. I have my 6-month-old nephew. He was born with eczema, and he is like real red, like spots on his legs, his arms.
Stop. Is your 6-year-old nephew, is he born to your sister or your brother?
My sister's daughter, my niece.
Okay, so he's a grandnephew. He's not your nephew, he's your grandnephew. Okay.
Right.
Yeah, and so if he has eczema, right away, your mother passed on to all of her kids, including you and your sister, gluten intolerance, okay? And so the children have it, and the grandchildren have it, and the grandnephews have it. So everybody in your family, including you and your brothers and sisters, especially your sister's children, and your mama, if she's still alive, everybody needs to get on a gluten-free diet. A 6-year-old kid, I would definitely give that child, and everybody else in the family who has these problems, I would give them not only a gluten-free diet, no fried foods, no processed meats, no oils, and they need to also get on the 90 essential nutrients, something really simple, like just one healthy start pack per 100 pounds of body weight for a 6-year-old kid. And if the kid only weighs 50 pounds, 40 to, say, 60 pounds, that one healthy start pack will last them 2 months. So give them a half a dose every day, cut the half a dose in half, it's a quarter of a dose twice a day, and that's where I would start. And then give me a call back tomorrow, so we can spend some more time, but we've only got just a moment here. We're not going to get into the rest of your family members. Okay, Doug, how much time we have?
Got about 90 seconds here.
90 seconds here. Okay, Shar, I want you to take 60 seconds of the 90 seconds, and I want you to give a word of advice to keep people from going into the chop shop.
Well, you got to start taking care of yourself. And when you see commercials on TV where they mention death twice in the same commercial, a sane thinking person should know better than to even consider to take any kind of drugs that the side effect is death. And people got to start thinking outside the box, the coffin box, and start taking care of themselves, because nobody cares about how you feel better than you do. The doctor only gets involved when you screw up, and if you don't screw up, if you learn to take care of yourself, you'll never have to go to them. I don't go to them. I haven't been to one in 25 years. They're going broke because of people like me and Doc.
Thank you, Shar. I always got a kick out of Shar. She's exactly right. And so basically our goal here is to get the message out. You get on the 90 essential nutrients. Don't wait till you're sick and you have to take so much stuff to try and get out from behind the problem. You want to be like Shar and me. If everybody in America were like Shar and I, medically, just think about it. She hasn't been to a doctor in 25 years, and I haven't been to a doctor in June. It'll be 68 years. Okay? If everybody were like she and I medically, in America, the medical system would be real humble. Right now, people go there every week. They go there every month. They go there 3 times a year for the rest, their whole life. And so it's a constant stream. And, of course, government agencies, and they advertise and push people. Oh, you got diabetes. You got to go get checked all the time. No, you don't. You can do it yourself. Get a hold of the book, Let's Play Doctor, and learn how to monitor your own disease, do your own lab work, make your own diagnosis. You're a lot safer than your doctor. Well, thank you, Shar. Super job. Thank you so much, Doug and Billy. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.